see, I have my mask on because I'm out here about to get ready to get my procedure done for the endoscopy. I just wanted to do a quick video to let you guys know that I am still on top of my game. I'm getting my things done and my checklist marked off of all the required labs and different tests that need to be ran. So this is one here. I have an 11 o'clock appointment. They said I'll be here about 2.5 hours. So I just wanted you guys to get a quick note of me taking care of business, TCB. As you see, I'm being very protective with my mask on. This is our new normal. And I just wanted to thank you guys for tuning in to the channel. Hey, I hope we can keep being uplifting each other, and you guys can give me a good luck of support and covering of blessings for whoever's supposed to perform the procedure on me, so that I can come out well with no issues and no problems. So I declare and decree these things in Jesus' name. And I just thank you guys for tuning in and for liking my quirky videos. And even when I mess up, hey, it's all in the master's plan, okay? So as y'all see, I'm out here ready, girl. Yeah, got my little earrings, got my mask on, my earrings. Look at y'all. Y'all see I like to coordinate. Y'all see I like to coordinate. Hey, now, you gotta be fashionable. You gotta be fashionable, girl. All right, now, so this is the endoscopy appointment. Again, I have to be there at 11 o'clock, and it's going to be here for 2.5 hours. This is the procedure where they put me to sleep, and they check my stomach lining and all that good stuff. So till the next time, I will give you guys an update later on after the procedure is over to let you know how I fared. And thanks again for tuning in. Love you guys. Thank you for tuning back in. I am now doing a follow-up from earlier this afternoon when I told you guys I was at the facility where I was about to have the procedure done to find out whether or not I have any digestive diseases. So right now what I plan to do is I plan to tell you guys everything that I experienced at the facility today, and what happened while I was there, what they did, what they told me, and pretty much what were the results that I was given after the procedure was finished. I actually got to find out something immediately after everything was done, once I awoken from the anesthesia that I was given. And so I'll be able to give you guys a play-by-play of what took place this day for the appointment that I had involving the endoscopy. So basically, as you know, everything is still under COVID-19 restrictions. You guys can see that I still have my hospital band, and I put an IV in my hand, which was very painful. So it was mostly a lot of waiting, which I find now when we go to, when I go to rather several of my appointments, if I do go in person, that I'm sitting there mostly wasting my time with just waiting to be called in the back to talk to the doctor. And then once I am with the doctor, it only takes about maybe a 10 to 15 minute time frame that's spent in engaging with the actual doctor. So once I checked in today, a lot of my time was just waiting to be called in the back to get the stuff, the procedure done. And when they did call me in the back, they have like a little gurney bed or whatever for you, and they have a robe that you have to change, take your top off, and put the little gown on, with the opening towards the back. And and they have hospital socks for you. But if you want, you can keep your shoes on if you're comfortable with having shoes in the bed. I opted to take mine off. So I had the hospital socks on. Then they give you also the hospital bag, you know, the patient belongings bag for you to put your things in. And then they go on to ask you a whole bunch of different questions. Questions about, have you ever had any issues with ulcers, or have you ever had any issues with heartburn? What type of medicines do you take? Have you any problems with any type of medication? You know, things of that nature. Are you a smoker? Do you engage in any type of recreational drugs? If so, how often do you do that? I happen to be a marijuana smoker, so they asked me questions about that. How often do I smoke? How many times a day do I smoke? That's like, man, I can't even give an answer to that, honestly, truthfully, to a doctor. But you know, you just say something like, oh, a couple times a day. So, of course, I went through that whole rigmarole. I had to give them a urine sample. She asked me, do I still have a cycle or whatnot? And I expressed to her that I did. So I had to give a sample of my urine before the procedure was done. There was a couple of people ahead of me. So basically, she told me that that was pretty much the longest thing that was going to take up most of the time. Once that person got done with me, it would take like 10 or 20 minutes for the other person to get her procedure taken care of or whatever. And then they would take me in the back. The anesthesiologist came out and introduced herself to me and told me that she would be the one that would be handling that part of the procedure. So that was nice. Most of them were very, the registered nurses were very cordial and friendly, and, you know, wanted to be as helpful as possible. So that was pretty much the stages of what I went through. In the beginning was, like I said, a lot of waiting. Once I did actually go into the room, they told me the procedure would take about no more than 10 minutes. They end up, I had my mask on for the majority of the time that I was waiting to be taken into the actual operating room. And then once they took me there, I had to take my mask off, and they gave me like an oxygen mask to put over my mouth and nose, as well as a nose cannula, kind of like the one I introduced in my previous video, Sleep Study Saga. They use that same type of nose cannula in this procedure today. And they also had something called a bite block that they had me put inside my mouth, and that went in my mouth, and then the oxygen thing actually went over the bite block, which it was very uncomfortable. And then while they're doing all that, the doctor came and introduced himself to me. I had only met him once. I spoke with him one time prior, and that was through a video conference. So I joked that he looked younger than he did on the video conference. And so that kind of broke the monotony of my apprehension that I was feeling. Anytime I have to be put under anesthesia, I always get some anxiety about that, because, you know, things happen. And they told me that once they did give me the medication, that it was going to go very quickly and I was going to fall asleep very quickly. I was experiencing a lot of pain within my hand with that IV because, like I said earlier, or if I didn't say, I have a problem with needles. And so I'm already skittish about that. And then sometimes, you know, we have rolling veins and things like that, and it may be hard for a person to get your vein in order to insert the needle, whether it's in your hand or whether it's right here in your arm. So it was just very uncomfortable when that lady put the needle in my hand. So when I told her, and then the girl was like, oh, okay, well, once they hooked me up with all that stuff and put all the leads on for the blood pressure cuff and this and that. And they explained to me that they were going to be checking to make sure to see if I had any type of acid reflux. This is what this procedure was for, was to check to see if you had acid reflux, check to see if you have stomach ulcers, and I guess other enzymes in your stomach, as well as they also took a little piece of tissue and like to do a biopsy on it, and then they said that the biopsy was going to go to a pathologist, and the pathologist was be giving the report to the doctor that I'm supposed to do my bariatric surgery for. So she told me, the nurse, that it would take about 7 days for that report to be put together. But the results of whether or not if you had any type of thing like the acid reflux or any problems that he saw when doing this procedure, they would let me know right away once I woke up out of it. So that's pretty much what they were checking for. Previously, I stated that they were checking just the stomach area, but I found out when I went there today that it was more than just the stomach that they were checking, because when they put the tube down your throat, they're checking the throat part and the esophagus, and as well as your stomach too. So once they did all that and they hooked me up, like I said, with that oxygen mask and the bite block, then she says, okay, now we're going to insert the anesthesia and you're going to fall asleep real quick. And I obviously, so they had to rub my hand, and when she rubbed the anesthesia in my hand to get the medicine, I guess intravenously through the IV, it was hurting. It started off hurting first, and then she was like, I was like, ow, and then next thing I know, I guess I was out of it, because next thing I remember, I was already woke up. And I said, did you wake me up, or did I wake up on my own? The nurse said, you woke up on your own. And I said, oh, okay. And I was so thirsty. I remember just feeling so thirsty, because this procedure is a fasting procedure. So they tell you that you can't have any food or drink, including water, the day of the procedure. So all morning, my appointment wasn't until 11 o'clock this morning. So when I woke up, I wasn't able to eat, or not obviously not eat, but I couldn't even drink water, which was hard for me, because I normally wake up into a glass of water or whatnot. So I just remember my mouth was just so dry, and I wanted something to drink, and they were like, oh, we ran out of water. And I'm like, but we have juice. And in my mind, I'm like, I don't want juice. Juice is just going to make me more thirstier. So I ended up settling for even tap water. At that point, I didn't care what it was. I just needed some H2O. And then I still had her give me some juice after that. But when I woke up from the procedure, the nurse explained to me that they found that I do have acid reflux or something, and they gave me these post-op and these discharge instructions, and I have to now take some new medication called Prilosec, and every day they gave me like a 3-month supply or 90-day supply of this medication, which ended up being a whole nother story, because when I went to go pick the medication up at CVS, and I had to get a prior authorization. The doctor needed to submit a prior authorization before I could even obtain the medication, unless I chose to buy it over the counter and spend my own money for it. So of course you have to jump through the hoops for that again, but it was very disheartening to find out that I did. I never thought that I had any type of a problem like that before. I know when I was younger, in my teenage early 20s, I had a gallbladder issue very badly, which I'm wondering if that's kind of like a genetic thing, because most of the women in my family on my mother's side has suffered from this issue, and they've also had to have their gallbladders removed. So they told me that Only thing I noticed that I had was an issue. Sometimes after eating certain foods, I would have this problem with like belching or whatever. And sometimes it's very uncomfortable and embarrassing, especially if you have a mate, doing that around the mate. I was talking with my younger sister about it, and she actually gave me a good analogy of what it actually sounds like when you're doing it. And I had to laugh because it was so true. You sound like a bullfrog. It's like a bullfrog sound. And no matter what you do, you can't control it. And it's just so embarrassing and nerve wracking. But you know what I'm saying? You have to do it. And sometimes I never experienced where like a heartburn feeling, but I have a feeling of that, like a feeling maybe like if it's trying to come back up or something, or I don't know, just the uncomfortable feeling. So I ended up learning today that that feeling or that thing that I was experiencing actually had a name for it, and so that name was acid reflux. And they're telling me that unless I get this medication started as soon as possible, it may hinder me or slow up my procedure, and trying to get the date for the surgery as soon as possible. So that was a little discouraging, but everything so far has been kind of smooth, so even that's not even discouraging because I can't let that stress my mind or what I'm saying, get me down, because I've been on this track for going on 2 years now, and I know what I need to do in order to get the ball rolling. I've already got the ball rolling, in spite of changing to a different county and starting over with new doctors who don't want to listen to you when you're trying to explain something in the first place. And then in the midst of a pandemic where you can't even really be heard unless you're talking about you infected with COVID-19. So, I've been jumping over hurdles and dodging bullets all my life, I guess. So this is nothing new. But, I do want to make sure that I try to get these people to move as quickly as possible. Or, just like they ladies told me to just buy the medication myself over the counter. I ended up being blessed. I told you guys before that my baby sister just had the surgery. So she also was prescribed the type of medication that they're requiring me to take for some of the same reasons, not for having acid reflux, but I guess because she has issues with heartburn and nausea or something like that. And so I guess that's medication that they already prescribed the facility that she's associated with in regards to her surgery that she's already have. So it was a blessing that she was even able to have this medication to be able to help me out so that I don't really have to worry about coming out of pocket right now. I can, wait for the insurance and still get this medication in my body as soon as possible. So, again, things are looking up. We're seem to be on track. Everything is unfolding, and I'm learning more as I go. I guess a lot of people, never know that they have these type of issues. And my sister told me that that this acid reflux is also attributed to being overweight. But I don't know if it's an overweight thing, because I know a lady that's almost thin as a toothpick, and she has to take this type of medication for acid reflux, and she calls it her PPI. And she has to make sure she takes that every day, or she says that she'll be out of commission. And and she has to avoid certain foods because it'll irritate that and make it really bad for her. So I don't know if it's a weight thing. I think also that my husband kind of suffers from it too, but his is in the form of like hiccuping. So he doesn't have like a burning sensation or a belching thing going on. He more or less has like a hiccup attack, and he can't stop hiccuping for, you know what I'm saying, sometimes hours on end. So I said to him, hey, after me getting this procedure done today, I even suggested that he try to get himself tested for it, because I guess, you know, it's my sister said that it could be attributed to spicy food, but it might not even necessarily have to be spicy food. It could just be like certain sauces, like tomato sauce or spaghetti sauce, enchilada sauce, stuff like that. So you know, I guess we have to learn what our bodies like and what we can take and what we can't take. And as you get older, certain things change anyways. What you could do when you were 20 and when you were 15 or when you were 5, 10, you can't do when you 40 and 50. Unfortunately, you know what I'm saying? So we have to readjust, and we gotta, you know what I mean, act accordingly. Hey, you know what I mean? We ain't no spring chickens no more. That's all right though. An old hen is just as good. Yeah, y'all know what I'm talking about, huh? All right now. So I just wanted to let you guys know that today was very eventful. It was very informative. After I had to have a driver, so they called my husband and let him know once I came out of the procedure and out of the anesthesia a little bit more, because in the beginning I was sort of loopy and I was trying to understand what the woman was saying to me, and you know, but they still try to move around. They don't want to really spend too much time on one person. So I was expecting the doctor to come and talk to me, but the doctor didn't come talk to me. They told me I'd have to wait to try to hear from his office or hear from him at a later time, or he'd do another video call with me. So I really still didn't get very much information. It was kind of surface information. So I still do have to follow up in regards to exactly what's going on, so I can get a better understanding of what this finding was that he apparently, you know, is saying that I have, and why exactly he wants me to take this medication. How long do I need to take this medication? Because I'm asking these questions like, is this something I have to take for the rest of my life? You know, how, you know, what is the duration of this these medications? Because I'm not a person that really enjoys taking a whole bunch of pills. So you know, these are things that we have to visit a little more in depthly. But I will definitely be contacting, you know, the doctor probably more better next week or something, because we are getting close to New Year's in a few days, and, you know, the beginning of a new year, and the coming up of another weekend. So I am not a fool to know that I won't be expecting to hear from anybody right away this week, you know, especially since the procedure was just done today. I also wanted to let you guys know that my next video, I want to talk a little bit about a symptom called that some women suffer from, and that is called polycystic ovarian syndrome. And when some people, women, mostly it only affects women, when we get those, you get a symptom called hirsutism or something like that. And that's when you get the facial hair. Some women might get a mustache or even grow like a whole full beard. I've always suffered with this. This is so disrespectful. I mean, the older I get, the more it's coming. And now it's even starting to try to come in gray. So I kid myself, because I'm like, you cannot. I'm even giving y'all a close-up of the gray chin hairs and how disrespectful they are. I mean, I already have to suffer from the salt and pepperness of my hair on my head, you know, when I'm not rocking one of these true dainty fashionable wigs of mine. But to be having it on my chin, I've been dealing with this since I was in my late teens, early 20s, and I feel like I'm the only one who suffers from it, besides my mother and my grandmother. Out of my siblings, I have two younger siblings. They don't really have to contend with the facial hair. My middle sister a little bit. She has like a light mustache, but nothing like this, you know. And my mom and my grandmother, they always did the plucking with the tweezers. I wasn't into the tweezer thing. I when I was younger, I had, you know, I did mess with it a little bit, and I even had a guy that, you know, would tweeze my face for me. But mostly I use razors to, you know, get rid of it quickly, and that's not always good because it can leave dark spots on your face and your neck, and it can cause the hair to grow back thicker and grow back faster. So my sister has been trying to convince me to go and get my face waxed or tweezed at the nail shop, which I've never really been into that thing either. I did try wax one time, but I wasn't into like the quick ripping of the of the skin with the hair. That was a little bit too much. But she sent me something that she found, and I'd like to try to do a video next time about that, you know. So I hope you guys will tune in and watch that video and follow that. And even if you have some suggestions of other maybe products or tips that I can use to try to tame the hair, or what could I do to make it not grow back so much, especially now that, you know, I'm older and it's coming in gray. That is just really, really, like I said, so disrespectful. And you know, sometimes I get tired of constantly having to do the shaving thing, or my husband saying, oh, you need to shave. Or even when I was younger, you know, I'd have relatives, you need to shave. And you know what I'm saying? Who wants to be hearing that? Like, nobody. It's so embarrassing. So thank you guys for listening to me this evening. And I hope the things that I had to say about the procedure were helpful. If you have any other questions, or I will, guys, give you a, you know, different update if I get any more information in regards to what the doctor said to me. But as I stated before, it's going to take a little time to do that. And so again, I just want you guys to keep on being you, keep on being great, and thank you as always for hitting that like and subscribe button. And thank you for dropping a comment or two if you have. Thank you for listening to me and allowing me to share my journey and my path with you guys. And as always, Kovan loves you. And you know what I'm saying? I'm thinking of you, and I want you to keep thinking of me too. Thank y'all.